Hi, everybody. I'm Dr. Sun, the special need lecturer. My topic is Principles of Management 1, Treatment and Planning, Preventative Care, Restraint, and Referral. I'm the Director of Pediatric Dentistry and the Special Care Dentistry Department, China Medical University Hospital, Taichung, Taiwan. Assistant Professor, School of Dentistry, College of Dentistry, China Medical University, Taichung, Taiwan. The Review Committee, Taiwan Academy of Pediatric Dentistry. Review Committee, Taiwan Academy of Special Care Dentistry. How many number of special needs in Taiwan? According to the Ministry of Health and Welfare in Taiwan, there are 1.19 million special needs in Taiwan in 2021 and accounted for 5.1% of the total population in Taiwan. And the people over 65 years old is the major group, accounted for about 45%. The definition of special health care need. According to the Textbook of Dentistry for the Child and Adolescent, MacDonald and Avery's 10th edition, special need could be divided into 9 categories. People has only one of the following characteristics or fit one of the following characteristics, and it could be diagnosed as a special need. First is medical, and the second is physical. The third is developmental. The fourth is mental, and sensory, and behavior, and cognitive, and emotional impairment, and social problem. And the special need can be divided into 3 groups according to the time of occurrence and the cause of occurrence. First is congenital. Second is acquired. The third is adult and aging. The types of special needs belong to congenital. First is systemic disease. Second is mental retardation. Third is cerebral palsy and epilepsy and Down syndrome, autism, rare disease, and others. And the occurrence belong to acquired. First is trauma, like brain or extremities, and a tumor or cancer, and a stroke, and an infection, like bacteria or virus, complications of chronic disease, and psychiatric disorders, and others. And the occurrence and the time to be diagnosed at adult and aging stage. Spinocerebellar atrophy and Huntington disease and amyotrophic lateral sclerosis and dementia, Parkinson's disease and Alzheimer's disease and others. And the common dental problems in special need. They usually had a lot of dental problems because they cannot brush teeth by themselves and the caregiver couldn't provide good oral care. It's also difficult to cooperate and receive oral check. The first problem is caries. Second is gingivitis and periodontitis and pulpitis, pulp necrosis, and residual roots, and missing teeth. The impact of dental problems on the body health. First is chewing problem. Severe tooth decay and missing teeth lead to chewing difficulty. And upper respiratory infection. Poor oral hygiene accumulate lot of bacteria and easily had upper respiratory infection. And the disturbance of digestion. Because the chewing difficulty, patient cannot chew well and swallow. And this problem will increase the burden of stomach and lead to the disturbance of digestion. Nutrition imbalance. Patient favor soft food and reject hard food will result nutrition imbalance. Overweight or underweight. The unbalanced diet will result overweight or underweight. And the last is the poor life quality. And how to make a treatment plan for a special need. It's difficult and complicated to make a treatment plan for a special need. It depends on the following factors. The first is the types of special needs. Second, the degree of cooperation. Third, the systemic disease conditions. Fourth, the severity of tooth decay. The difficulty of making a treatment plan. It's hard to collect complete and detailed information for special needs, including history and careful inspection, careful examination, and periapical X-ray films or panoramic films and models due to lack of cooperation. And the difficulty of making a treatment plan. Because the treatment plan also need consultation, multidisciplinary team including physician and dental specialists before making a treatment plan. The types of special needs. There are many types of special needs, and the levels and the severity are varied. For examples, cerebral palsy has different types, and the severity is different. And identify the characteristics and the precautions before making a treatment plan is the most important. The degree of cooperation. If the patient can cooperate with dental treatment, treat it in the outpatient clinic. Follow the outpatient procedures. If the patient cannot cooperate with dental treatment, treat it using sedation or under general anesthesia. The systemic disease conditions. Consider the physical condition and the health status must be evaluated. During course of treatment like chemotherapy, radiotherapy, or immunotherapy should be considered very carefully. Or bleeding disorders need a coagulation factor before and after dental treatment. Some patients need inpatient observation after dental treatment like cancer, immune disease, heart disease, bleeding disorders, epilepsy, and others. The severity of tooth decay. If the tooth decay was severe, considering the multiple dental procedures may stimulate or trigger the instability of emotion, vital signs, seizure, or other unpredictable conditions. And the treatment was complicated and multiple to tolerate for patient. Suggest patient receive dental treatment under sedation or general anesthesia. In this picture, this is a 30-year-old male, had moderate mental retardation. No systemic disease. The diagnosis was caries over posterior molars, over upper and lower bilateral side, and a residual root over first molar, lower right side. And full mouth gingivitis with plaque accumulation. And the treatment plan was composite resin filling, posterior molars, over upper and lower bilateral side, and extraction the residual root of first molar, lower right side, and the full mouth ultrasonic scaling. The treatment plan was not complicated, couldn't be considered and arranged under sedation. In this picture, the tooth decay was very severe, and the patient had mental retardation, cannot cooperate in the outpatient clinic. The treatment plan was complicated, including endodontic treatment, prosthesis, extraction, and operative dentistry. So the treatment should be arranged under general anesthesia for a complete full-mouth dental treatment. And the advantages of treatment under general anesthesia. Most of the procedure and the treatment could be complete and executed according to the treatment plan. And the treatment plan will not be interrupted due to some factors, and do not need the cooperation of patient, and reduce the risk of infection, reduce the treatment times. And how to make a treatment plan for a special need under general anesthesia. The comprehensive treatment plan needed to be developed after consultation with multi-specialists, including physician, pediatric dentist, endodontist, oral surgeon, and a prosthodontist, and also need to be discussed and reach a consensus with the patient's family before the treatment. And it's a professional team treatment, professional teamwork. The social worker and welfare system are also needed and provided to the patient family. And before general anesthesia, patient need to check the chest X-ray, check blood routine, and go to the pre-anesthesia assessment clinic for evaluation, and check EKG if patient had heart disease history. A comprehensive treatment plan should include the following treatment works and will be performed under general anesthesia. First is diagnosis. Because patient is not cooperative, so diagnosis must be performed under general anesthesia. Second is taking periapical or panoramic films. Third is operative dentistry. Many tooth decay need to be filled, and endodontic therapy, and extraction hopeless teeth, and crown fabrication, and fluoride application, and oral hygiene instruction, and a regular checkup. Case study and analysis. And it's a 16-year-old female, had a severe mental retardation, no systemic disease. The diagnosis was upper central incisor, right side, missing due to trauma. And the tooth decay over first molar of lower left side. The treatment plan was prosthesis fabrication, a dental bridge from upper central incisor of left side to lateral incisor of right side, and the stainless steel crown restoration of lower first molar of left side. Due to patient cannot cooperate with the dental treatment, the treatment plan was performed under general anesthesia. And this is the picture after dental treatment. The dental bridge from upper central incisor of left side to the lateral incisor of right side was delivered, and a stainless steel crown of lower first molar of left side was delivered under general anesthesia. And this is a case of cerebral palsy with epilepsy. And this picture was patient post-operative photo. This is a 28-year-old male, had a cerebral palsy, and a seizure attack several times in one day, and he was sensitive to the change of room temperature. The diagnosis was pulp necrosis over upper central incisors, both right and left side. So the treatment plan was endodontic treatment, upper central incisors, and restored with porcelain fused to metal crowns. The treatment was performed under general anesthesia, prevent for seizure attack during the dental treatment. And this is the case of 25-year-old male, had Down syndrome, and he denied any systemic disease and congenital heart disease. The diagnosis was chronic pulpitis over first molar, upper right side, and the second premolars, upper left side, and the lower left side, and the lower right side, and had mild gingivitis. The treatment plan was endodontic treatment, the chronic pulpitis, and restored the teeth. The second premolars with porcelain fused to metal crowns, and the upper first molar, upper right side, restored with stainless steel crown. And the patient also received full mouth ultrasonic scaling. The treatment was performed under general anesthesia. And this is the photo post-operation. The tooth had treated and restored with crowns. And this case is a 23-year-old female, had a severe tooth decay with severe mental retardation, and she denied any systemic disease. The chief complaint was asked for full mouth dental treatment, including prosthetic fabrication. Due to the uncooperation, she received the full mouth prosthetic fabrication under general anesthesia. The upper incisors and the premolars received endodontic treatment, and post-cementation, and the crown and the bridge were fabricated and delivered. The upper first molars were restored with stainless steel crown, and the upper second molars, the residual root, were extracted. The second molars were extracted, and the lower teeth had many cervical caries and restored with composite resin filling. And the lower side is the post-operation photos. The premolars was restored with crowns and a bridge, and the caries was restored with composite resin filling. Preventative care. Prevention is better than cure, and prevention is the most important for special need. And the preventative care include fluoride application, oral hygiene extraction, diet habit control, and a regular checkup The fluoride application include professional and home use. The professional is fluoride varnish. The fluoride concentration is 22,600 ppm. And the fluoride home use include fluoride mouth rinse and fluoride supplement and fluoride gel and tray. And this is the fluoride varnish. Should repeat the varnish every 3 to 6 months. The application method. First, clean the tooth surface and open the varnish and mix. And the direction of application is brush down the tooth surface from gingiva to the incisal edge and wait for seconds and close mouth and give the instructions for fluoride varnish to patient and wait for 15 minutes. The fluoride home use include mouth rinse, supplement, and gel. First is the fluoride mouth rinse. Fluoride mouth rinse are neutral water solutions containing sodium fluoride between 0.05%, 230 ppm, and for daily use, and 0.2%, 900 ppm, and weekly used. They are traditionally applied in school-based programs, but currently also recommended by dental professionals for home use. The recommended dietary fluoride supplement should be accorded to the age and the environment fluoride concentration in drinking water. And this is the fluoride gel from home use. Put the fluoride gel 0.4% stainless fluoride into the tray, both upper and lower, and bite for 4 to 5 minutes every day before sleep. And this is the fluoride gel. The importance of regular checkup every 3 months can prevent tooth decay and prevent gum disease and maintain good oral health and make your smile more beautiful. Improving oral hygiene among special needs. First, we should determine patients' ability to self-care by asking them to show you how they brush and provide specific recommendations based on results. Provide hands-on demonstrations to patients and caregivers how to effectively brush their teeth. If patients can brush teeth by themselves, adapt toothbrush handles to simply use, like this picture, and suggest other aids to use, such as floss holders and electric toothbrush for special needs. And the position of helping brush teeth for special needs. For special needs who can sit, and it's better to let them sit, and we can stand behind them or in front of them. For providing better oral care, it's better to have an assistant to help brush their teeth. Stand behind the special needs. If we stand behind them, their head could rest on our chest, and it's more comfortable for special need. And we can fix the head and hold their jaw with our left arm and hand. Hold their jaw with our left arm and hand. And they can also look in the mirror and understand how we help them brush their teeth. and this position could provide a sense of security. Restraint. The indication of restraint. According to the Use of Protective Stabilization for Pediatric Dental Patients, AAPD Guidelines 2020. Patient who requires immediate diagnosis and urgent limited treatment and cannot cooperate due to developmental levels, lack of maturity, or medical and physical conditions. The second, patient who requires urgent care and uncontrolled movements, risk the safety of the patient, staff, dentist, or parent without the use of protective stabilization. Third, previously cooperative patient who quickly becomes uncooperative and cooperation cannot be regained by basic behavior guidance techniques in order to protect the patient's safety and help complete a procedure or stabilize the patient. Uncooperative patient who requires limited treatment and sedation or general anesthesia may not be an option because the patient does not meet sedation criteria or because of a long operating room wait time, financial considerations, and parental preferences after other options have been discussed. Sedated patient who requires limited stabilization to help reduce untoward movements during treatment, and patient with special need who exhibits uncontrolled movements that would be harmful or significantly interfere with the quality of care. And the contraindications of restraint. Cooperative non-sedated patient. An uncooperative patient when there is not a clear need to provide treatment at a particular visit. Patient who cannot be immobilized safely due to associated medical, psychological, or physical conditions. Patient with a history of physical or psychological trauma, including physical or sexual abuse or other trauma that would place the individual at greater psychological risk during restraint. Patient with non-emergent treatment needs in order to accomplish full mouth or multiple quadrant dental rehabilitation. The practitioner's convenience. A dental team without request, knowledge, and skills in patient selection and restraining techniques to prevent or minimize psychological stress and decrease risk of physical injury to the patient, the parent, and the staff. And the documentations of restraint. First is indication for stabilization. Types of stabilization. Informed consent for protective stabilization, and the reason for parental exclusion during protective stabilization. The duration of application of stabilization. Behavior evaluation rating during stabilization. Any untoward outcomes such as skin markings. Management implications for future appointments. The risks, physical and psychological effects. The provider should consider the patient's emotional and cognitive developmental levels and should be aware of potential physical and psychological effects of protective stabilization. The majority of restraint-related injuries consist of minor bruises and scratches, although other more serious injuries have been reported. The risks of compromised airway patency. A rigid stabilization board may not allow for complete extension of the neck and therefore may compromise airway patency, especially in young children or sedated patients. Proper training and use of a neck roll may minimize this risk. And the risk of increased adrenal catecholamine and arrhythmia. Significant release of adrenal catecholamines may occur in patients who experience increased agitation when restrained by staff members or protective, stabilizing equipment. Excessive catecholamine release may sensitize the heart and cause rhythm disturbances. Referral. Patients need to be referred due to these factors. First is the complexity. If the dental problems were complicated and need multi-specialists to finish and to make a treatment plan. The second, patients need special technical or equipment requirements. The third is the systemic disease. If patient had a systemic disease and should be hospitalized for multidisciplinary treatment. Under these conditions, patient need referred. And in summary, comprehensive treatment plan can provide good treatment quality, and preventative care can provide good life quality. All these are very important in dental health care for special needs. And thank you for your listening.